Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 110,338 confirmed cases of COVID-19 in Canada and 37,604 in Ontario. Chatham-Kent has 173 cases, and Sarnia-Lambton has reported 290 cases. Michigan now has 73,663 cases, with 12,191 cases being in Detroit. Today, we are reporting 1,982 cases of COVID-19 in our community, an increase of 18 cases from yesterday. 7 are workers in the agri-farm sector, 8 are in the community, and 3 are still being investigated. 1,303 cases have now resolved. 571 people are self-isolating, and 8 people are in hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male, and 34% are female, with 1% unknown at this time. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes currently in COVID outbreak. In addition, there are 6 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test result portal. If you are unable to review your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates.
Good morning, everyone. Thank you for joining us again. Last week on July 16th, the federal government announced an extension of the closure of the border between the US and Canada until August 21st. The border closure prohibits all non-essential travel. This would be any travel that is considered tourism or recreational, including shopping. With more businesses in the US opening up, this increases the number of individuals traveling across the border daily for work. Essential travel includes work, where work from home is not possible or not an option. Essential travel also includes educational travel. Since the beginning of this pandemic, I have recommended that those that travel to the US for work or education on a daily basis regularly monitor for symptoms of COVID-19. Essential workers traveling for essential work purposes are not subject to Quarantine Act. However, workers should restrict their activities to work and home only. Essential workers should avoid shopping or engaging in non-essential work activities while in the US for that purpose. We've received many questions related to screening for COVID-19 and how it applies to essential workers traveling out of country for work. I, along with my colleagues that are part of the border communities, are also reached out to the ministry to discuss these issues and how best to address the standard screening question for essential workers. until we get a direction coming from the ministry. We'll continue with our local recommendations in ensuring that anyone who is traveling across the border should restrict their activities only for essential work and then just do their work and return back to Canada safely. We are also seeing some travel-related cases in our region, which was something that we got a good handle on, especially in the beginning. In the initial phases of COVID-19, we have seen many cases related to travel, but then in the middle, we've done an excellent job in preventing those travel-related cases. With the U.S. opening more businesses and more opportunities for our residents to travel, whether for work, and all for the essential reasons, it is still a good reminder that the number of cases that we are seeing in our region compared to what is happening in the U.S. is still significantly different, and the likelihood of us contracting COVID-19 while our travel to U.S. is something that we should always be mindful of. The same goes for anyone who's coming from the U.S. as well to Canada. They also need to restrict their activities or to their work only for their essential work and then immediately return back to their home country. Stage 2 and Stage 3, as we're seeing from the transition of what is happening with the more businesses opening in Stage 2, there's obviously this risk of community transmission when more and more people are coming together. This is a good reminder that we still need to do all those physical distancing measures and public health measures that are currently in place. It is absolutely important for all of us to follow those measures and continue to follow those measures despite the understanding that there are more the rules and are much more relaxed, but COVID-19 hasn't gone away, and that is why it is still important that we keep it that way and make it our part of our behavior and our habit to practice physical distancing, wearing a mask when physical distancing is not possible, and most importantly, monitor your symptoms and stay home when you're sick. If you are concerned that you may have come in contact with anyone who has COVID, please get yourself tested and immediately isolate yourself until you get the results back for you. It is absolutely important that people who are sick should stay at home and not go outside to prevent any further spread in the community. When it comes to social bubbles and the number of people that people are allowed to congregate together, it is absolutely important that we restrict to that number. The low number of contacts we have, the better it is from a public health control perspective and limiting the spread. What we are seeing in the community now is people having more contacts and more contacts coming back positive. So it's absolutely important that we follow those measures. Workplaces are also an important area that we need to pay attention to as more and more businesses are opening up. Workplaces should have strong policies in place to protect their employees and also have their screening requirements for all those employees. It is important that even in the workplace, physical distancing and the number of close contacts are still maintained, and every effort should be done to ensure that physical distancing is maintained at all times, and wherever physical distancing is not possible, the use of appropriate cloth mask or some kind of face covering is important to prevent and limit the spread of the disease. Any concerns with an employee who may be exhibiting symptoms of COVID or some symptoms that may be suggestive of any acute infection, they must stay home and they should get tested before they can spread it to further. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Yes, good morning, Doctor. The new cases that came over the last 3 days in farm workers, are they all from one farm or is it separate?
They are at least from 2 to 3 different farms with a varying number of cases. They're not just from one farm.
And you mentioned in your briefing there that community cases are on the rise and workplaces should be, making sure that they have policies in place. Are the new cases that we're seeing, those community cases, happening at specific workplaces? Are there more outbreaks, or do we have any sort of indication where those community cases are coming from?
So we do not have, we haven't established any potential link to workplace that transmission is happening at the workplace. But what is important that if the person who is sick, if they end up in going to these workplaces, the potential for them to spread it to people would be much higher. And depending on the type of work environment, it could lead to an outbreak at the workplace. So most of these messaging that I want to put out is the importance of staying home when you're sick. So I think this has been the message right from the beginning, and we wanted to remind people that it is still in place. And with COVID being such a new disease, and with symptoms that can be vague enough, if there's any suspicion, any concern, people should immediately remove themselves from coming in contact with other people and get tested, especially if their work or if their contact is suggestive of new people, new exposure, more likelihood. If you are concerned about that, please stay home and get yourself tested to rule it out before spreading it to others.
And as you mentioned too, stage 2 and stage 3 in reopening, I mean, the spikes that we're seeing, most of them continue to be in the agri-farm sector, but do you take these higher numbers as an indication that reopening is not going well in the region?
I think what is important is as we continue to see these cases, and not all the farm workers and their activities are limited to the farm only. They also live in our community. Some of them, some of these farm workers are also living at other parts of the Essex County, including City of Windsor and some of the other places. So the potential for anyone to spread it to other places is always high. So I think that's why I caution anyone who tries to think that it's a local problem to limited to one municipality and not to others. I think we need to be mindful that whatever we are doing has the potential to spread across the region. So all of these measures, all of these policies that are in place should be applicable to everywhere, and there's the potential to spread to community anywhere in the Essex County is high, so we should be taking all the precautions all the time and keeping a close eye on everything. Physical distancing, wearing a cloth mask, face covering when physical distancing is not possible is still by far the best measure that people can use, and most importantly, if they're sick, staying home and do not go outside.
Thank you.
Any questions from Blackburn?
Not right now, thank you.
Any questions from AM 800?
Hi, good morning. I just wondered, Dr. Ahmed, you were talking about the border and, reminding people not to be shopping when they're over there, to essentially go to work or go to school and come back. Did anything in particular prompt this warning? Have there been issues or an increase in problems that you're seeing or that are being reported?
Well, so we have seen some travel-related cases in our region that basically travel to Michigan, so that's a concern. And recognizing that there are people who frequently do that, and it may not necessarily be being captured at this point through either by acquisition of the disease itself or them identifying what activities they were engaged with. So I think it is important that we continue to put that message out there that it is important. Those measures are continuing to be still in place, and the disease is out there. Basically, it's just a matter of time that we can go from bad to worse. So I think it's just it's a good reminder that we should keep that in mind, irrespective of how long we've been practicing that. And I know there's people have done an excellent job in following all those public health measures, and unfortunately we are still in the middle of it, so we'll have to be mindful and we'll have to follow all the public health recommendations until we get a vaccine or something that is in place. The more it becomes much easier when it just becomes part of the behavior. It takes time, but I think we have done a good job in adopting those behavior. We just need to learn to maintain those behaviors and continue to follow that.
Okay, thank you. And another, semi-decent weekend weather-wise, with the exception of yesterday, lots of municipalities and areas doing open-air patios, extending them out onto the street and the parklets in the city of Windsor. So just, again, have you been receiving an increased number of complaints, or is that tapering off, or have you had to levy any fines or anything stronger than a warning or education?
Um, Yeah, it's the same. We haven't seen any difference in terms of the number of complaints that we are receiving, and to my knowledge, we haven't issued any fine either. And a lot of the businesses, I think, they're just complying when they're properly educated. And sometimes it's not a function that they're not doing it. It's just a lack of education. So we educate them, and majority of them are taking our lead and then just working with us to make sure that they are creating a safe environment for anyone who is visiting those facilities.
Okay, thank you.
Any questions from Windsor?
Good morning. Over the weekend, Erie Shores Healthcare in Leamington reported they're seeing a possible surge in cases. Could you elaborate on what's going on there? Where are those cases coming from, for example? Are they agri-farm or community?
So I think it's a combination of both what they're seeing right now in Erie Shores, and recognizing that they are a municipality that is seeing a high number of cases in their municipality compared to the rest of the region. So I did had some conversation with Erie Shores Healthcare over the weekend, and listen to their concerns and their need for restricting some of those movements in order to protect their vulnerable people who are in the hospital, who are coming in for various reasons. So I think it just combining all those measures, it is important that we have good preventive measures in place to have a good handle on anyone who wants to go and get tested. They should go and get tested, and ensuring that in that process they're not putting anyone else at risk of contracting COVID. So I think it's something that we'll continue to keep a close eye on to understand what's going on there and what are some of the additional measures that we need to put in place to ensure that the community spread and can be contained in a better way.
And we asked Erie Shores if they would provide information on the number of cases, much like how Windsor Regional has a webpage with that information. But they actually said that information would need to be provided by the health unit. Would you know the number of patients admitted at Erie Shores with COVID-19? And would the health unit consider providing that information regularly?
We do provide our weekly summary that captures all the hospitalization and ICU utilization in the region, and so that includes Erie Shores as well as Windsor Regional Hospital's ICU beds utilization, acute care beds related to COVID, and overall hospital capacity. So that data does come from public health. And I think it is important that we keep that data in a place where we can capture all the nuances. So public health is typically the best place to access for all your data because we do get data from all those different sources. And the whole idea and purpose of sharing those weekly epidemiological summaries is to make sure that everyone is aware of the most recent numbers in the region.
Any questions from the Windsor Star?
Yes. Good morning, Doctor. Did the Ministry of Health indicate to you that they would be working on some sort of guidance for cross-border travelers, more in detail than what local public health has come up with?
Well, I think that conversation is ongoing, and I can understand that there's a lot of things that ministry is involved with. Some of these decisions about the border is also tied with the federal government, so there has to be some dialogue happening at all levels, locally, provincially, as well as federally. We are trying to use the best evidence that we have for our region to make local decision. Recognizing that a lot of that is maintained and controlled by the CBSA officers who are interviewing all these people who are coming into the country, and vice versa, people who are traveling to US from the US side of the border as well. So I think we just need to make sure that they're all connected. Everyone is tied with the same message and using the same messaging. The screening requirement, the quarantine requirement is well communicated and well explained to everyone, and a mechanism should be in place to ensure appropriate follow-up of anyone who is traveling on either side of the border.
And have you been in conversations with any public health officials from regions that are other border cities? Are they experiencing similar issues?
Well, we do have our colleagues across the province, the medical officers of health from Niagara, Lambton, and also I think those are the three borders that people use mostly, but there are other border cities as well, and that the ministry is trying to put together and initiate that dialogue. But we do connect informally with all my colleagues, and we do share some of the key messaging, recognizing that there's still something that we need from the ministry to ensure consistency.
Thank you.
Any questions from CTV?
Yes, good morning. So just to pick up on Taylor there, so like in the grand scheme of things, are you worried at this particular time that there may be an influx in travel cases coming?
I think we're starting to see some of those travel-related cases, and I think as part of public health messaging, we try to do more on the prevention side, and we want to make sure that before it gets worse, we can put some measures in place to prevent it from happening in the first place. So I think that's where the focus is right now, and recognizing that many of the activities, many of the businesses opening in U.S. is leading to more cases, and we have a very different system here. We're following the provincial recommendation. Our case rates and everything is much different than the U.S. So it's just understanding that even if someone who's living here, they may see things differently based on day-to-day activities, versus when they're traveling to US, they may see a different type of activities, different type of behavior, whether people are wearing the mask or not, whether people are congregating, physical distancing is maintained or not. So I think there's a number of issues that they need to be mindful of, and ensuring that they are protected, and they're not putting their families and their community at risk.
All right. I know phase 3 is a big talk today, so I'm just curious. I know that you're big on creating or logging as much data as you could. You said like a 3 to 4 week period, so we're kind of in that zone now. So do you think we've had enough data provided to give you sufficient cause for our region to move into the next stage, or do you still want to accumulate a little bit more data?
So I think the need for data for me and for the province is different, and the provinces definitely would be interested in ensuring that they have good data to make decisions, and there are a number of ways to capture that level of details by recognizing what disease is, and how long it takes for this disease, if it has to spread in the community, what timeline they should be looking at. So they are considering all those recommendations and looking at our data. We do provide them with a good breakdown of everything. We provide them with data on farms. We provide them data with the community cases. Our team that are inputting data based on the case and contact management follow-up. All that data is being looked at by the ministry, and they do some level of analysis on their end. We do our analysis at the local level, and we share all those data, and that helps them to make some of those decisions.
All right, and then lastly, just picking up on Friday, I kind of tune out when I'm on the weekends, but Erie Shores, I know they've been doing a lot of community outreach with various groups within the Leamington area. So heading back to that one community that in particular, is there an outbreak, or is there a fear of an outbreak within any community in the Leamington area?
So I think when we see few cases in any specific population, we do want to take some appropriate measure and do our work in ensuring that they have the most up-to-date information. They have all the resources and tools available to them to make a better decision, and to help individuals who would probably require some testing or any kind of follow-up that they need. So all those measures are critically important to do as an outreach for any of the community members. So we are doing that. We are engaged in that, and we hope that with our extra effort, we should be able to do that outreach and ensure that everyone have access to all the testing and the support that they need.
So are we saying there is or there isn't?
Well,
An outbreak in one certain community.
Well, I think what we're saying is we are working with everyone in the community to ensure that that we can support everyone.
Okay, fair enough.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thanks.
AMA 100?
No, I'm good. Thank you.
Windsorite?
No, thank you.
Windsor Star?
No, thank you.
CTV?
No, I'm good. Thanks, Mike. Thanks, Doc.
Thank you.